The ASFA guidelines have been in place since 1986. And when they first came out, there were 61 indications. The latest edition in 2023, there were now 91 fact sheets with 166 different indications. So if we use the past to look at the future, what we see is that through the ASFA guidelines, there's been incredible growth in the use of apheresis procedures. I think part of this is because the American Society for Apheresis guidelines make it very accessible for people around the world to quickly find the data available for a specific disease indication and see what others are doing with apheresis procedures. Apheresis, plasma exchange, even immunoabsorption, remain one of the fastest ways one can reduce from a patient's plasma whatever that toxic substance is while you wait for other therapies to work. And basically, we don't live in a static world, right? We haven't seen all the diseases we're going to see. We don't understand all the diseases we have. And so there are always new indications. And each round of the ASFA guidelines will include new fact sheets because people continue to use apheresis for different procedures, for different indications in medicine. Some of the new therapies are things like the immune checkpoint inhibitors. And in the latest edition of the guidelines, the autoimmune unintended side effects of these medications were included as an indication for plasma exchange. So many of these new therapies have some unintended off-target side effects where plasma exchange may have an important role. Many of these therapies are very expensive, and if you actually compare new drug therapy to a course of plasma exchange, often plasma exchange is the more cost-effective and clinically effective therapy. So I think there will always be a role in this regard for apheresis. In the 2023 guidelines, for the first time, autoimmune dysautonomia was included, and in this diagnosis, there are now people with long COVID who are having dysautonomia symptoms, and currently plasma exchange is being investigated as a potential therapy. And there are a number of patients around the world who are struggling with this condition or with autoimmune dysautonomia that has been caused by various infections or other environmental triggers. And so I think this could be a growing area for apheresis in the future. I also think that the data has been really excellent for plasma exchange as a way to facilitate ABO incompatible transplants. And this is something that has importance across the world because the number of people on the wait list awaiting transplant versus the number of available organs is a great mismatch. And now we're seeing, especially like in kidney transplant, that outcomes between an ABO compatible and incompatible donor are equivalent. And all of these protocols use plasma exchange or other forms of apheresis in the desensitization and antibody removal protocol prior to transplant.